Well, welcome back. Living with chronic pain is a daily struggle for millions of people.
It is, and our next guest dealt with that pain for years. His pain was so bad that even just turning his head from side to side was a major challenge. Dr. Michael McKee with North American Spine and his patient, Mike Smith, are here to tell us about how a minimally invasive procedure finally gave Mike some relief from this chronic pain. And Mike, I want to start with you too, because a lot of people deal with pain, but years of being a cowboy, you were thrown off a few animals, right? You even broke your neck.
Yeah, that's right. You know, I was real active in sports when I was young, and I found rodeo when I was about 16 and became a national champion, and
Awesome.
was kind of addicted to it at that point. And, you know, you mess with the bull, you're going to get the horn.
Mm-hmm.
So actually, one of the last bulls I got on in intercollegiate rodeo threw me off and fractured my cervical section, or broke my neck, basically. And so that was in the, you know, mid-70s, and so I lived with pain until I finally got enough of it that I went in and did the laser spine procedure, the IntelliSpine procedure.
You know, I know the photos that you're sharing here on the screen are incredible, part of your career. But Dr. McKee, this is something that so many people can identify with. You don't have to be a bull rider in rodeo to have neck or back pain, these injuries, and people live with this type of debilitating pain, and they think maybe there's no cure end in sight.
Correct. Yeah, so this is a less invasive procedure than a traditional surgery. Like, nobody wants to get caught and have a big 8-hour surgery, so it's nice to have this step. It's not for everybody. There's indications for it. But if you didn't get better with more conservative things like physical therapy and injections and things like that, this is another alternative that, you know, you're going home the same day with a Band-Aid. So it's a nice alternative.
And Dr. McKee, I think what you just said is really interesting. A lot of people don't want to face back or neck surgery because it is such a big deal and the recovery time. So as an alternative, they just live with the pain. But this procedure that we're about to learn more about is completely different. It's really non-invasive, and it can happen really quickly. So can you just talk us through how the surgery actually works?
Yeah, so basically with a little a small scope, or almost like the size of a needle, you go to the area where you have a herniation or a tear, and you might see this diagram there. This is, for example, in the lumbar spine, in the low back. And so you basically target where the tear and the herniation is, and instead of cutting all the tissues to get to that area, you're going through a small scope or almost like a small trocar, and then the laser, what it does, it evaporates that tissue and it kind of seals those tears. So you're basically going home with a Band-Aid without any major cutting, and your recovery is a lot faster.
And this is called IntelliSpine. For this type of procedure, you basically have to have an MRI or a CT to see if you are a candidate.
Correct. You have to see if you're a candidate, because it's not for everything. If you have no disc left and it's bone spurs, then this is not the procedure for you, maybe. But it's good to look into it before you commit yourself to a bigger surgery to see, are you qualifying for something.
But wait, so this is outpatient surgery then?
Outpatient surgery, yeah.
And this is to correct herniated or bulging discs. So if someone's been dealing with those things, they could come and see you and they could go home right away? Really?
Correct. They go home the same day, and so that's the advantage of it. I mean, you do have to maybe take a week off from work or something to take it easy, but
no lifting heavy boxes, right?
Right. And Mike, so tell us about your recovery, because I know you lived with pain for so many years.
You know, I finally got to the point where, you know, I was tired of doing the pain medication and injections, and I said, okay, I've been working with Dr. McKee, and I knew he did the procedure for the last 6 years or so. And I said, I'm ready. You know, I want to see if I can qualify for that procedure. And then North American Spine came in, and it was almost like a concierge. You know, they took my case, they got me approved on insurance, they defined the exact cost, everything was covered by insurance. And I went into Herman Surgical Center, and it was like going to a country club spa.
Right.
Everyone was educated, very high level of patient care. And I went in one morning, and I left, you know, right after the procedure, which was 50 minutes. And within a few days, I was, you know, going again.
That is awesome. And what about turning now, left and right?
Yeah, you know, back when I was fighting through the injections and the pain medications, it was difficult to even sit at a dinner table and have a conversation with someone to your right or left, because you got additional pain from the neck movement, where now it's not a problem. enjoy life a lot more. I get to do a lot more fishing and hunting because of this.
So you can go fishing and hunting and
That's great.
things. And are you back to work?
Well, I took an early retirement in 2012. I do have a real estate license, and I kind of work part-time doing that. So little work and a lot of play.
I like that. That's the way it should be, for sure. And, you know, he hit on a really great point where he talked about kind of the concierge or the spa-like feel. When people are dealing with an upcoming surgery like this, and there's lots of questions, insurance and the recovery, that's basically what you guys offer as well, right? Having that availability with your patients.
Correct, yeah, because the patients get like a case manager, and then that patient does everything for them, calls the insurance, sets everything up, the appointments, gets the MRI, so it's very convenient for the patients that way, and they coordinate everything for us too, when to shop for doing this procedure and things like that.
That's great.
Doctor, is Mike's experience typical? I mean, do you have a lot of patients who come to see you and end up doing things with the rest of their life that maybe they didn't think were possible?
Yeah, correct, because so many people live with chronic pain, and they think the alternative is, they already tried the more conservative things, they don't want to have a big old surgery, or they have had surgery or relatives, and they're still in pain. So this is a nice alternative, with less risk, I think.
I think it's really interesting. This is the first time I've ever heard about it. So it's the IntelliSpine procedure, laser procedure, and people can learn more about it by calling your office or logging onto your website, NorthAmericanSpine.com. The number to call is 877-474-BACK, which is 877-474-2225. Mike, I am so glad that you are feeling better today. It's nice to see you, and Dr. McKee, it's nice seeing you as well. Thanks for stopping by.
Thank you. And we'll be right back with more Houston Life.
The KPRC Channel 2 Habitat